with Medical Fitness and Wellness Group. I'm also the chiropractor for Inside Out Chiropractic at the same facility. I wanted to do a video on improvement of the cervical curve, which sounds a little bit too fancy. Basically, most people's problems when they're having issues with their neck and shoulder area is not having enough curve in the spine. So I've worked on and developed a set of exercises that will help you with that. And I use that with my patients who come to see me as well. So basically what you need to understand is that if I'm looking at you from the side view, the most common problem outside of having an injury or a car accident that's caused something to shift or break or tear, I'm just talking about just the typical alignment of the neck, is to have a forward curve. So when you're looking at me from the side view, the opening of my ear should be lined up with my shoulder, which is probably better to demonstrate it standing. And I have on the view box here, I have a picture of what a good spine looks like, and we'll get to that in just a second. But posture-wise, when I look to the side, again, the opening of your ear should be over the shoulder. And in fact, technically speaking, there's a little bump right here. It's called the acromion. That's part of your shoulder blade. That sticks up right here. You can all feel that on yourself. That's the spot that needs to be lined up with the opening of your ear. Now, a lot of people who have issues with their neck and the shape of their spine, without seeing an x-ray, I can tell when the head starts to move forward. And we all know many people, even young people, who have this posture now, and we always think it's because they're always looking down at their phone or tablet or having a desk job where you're always down at the screen. But if you're not paying attention to this, it doesn't hurt as it's happening. People will have a tendency to lose the curve in their neck. The head will come forward, and at some point, years down the road, you'll even start to see the shoulders start to come too. Okay? And you're looking at me now, and everyone's thinking, okay, I know about 30 people like that, right? So you're not necessarily going to have pain, but what's happening is your neck is straightening out, and the shoulders are following it forward. And that becomes a problem for two reasons. One, there's pressure on your nervous system with your head being forward. And two, once the shoulders start to come forward, it's very difficult, even for a chiropractor, to improve the curve of your neck because the shoulders start to block that extension. Okay? And hopefully that makes sense. Let me show you another example. So my spine is in pretty good shape. It's not perfect. I don't have a perfect curve, but I work on it and I focus on that. So my posture here is pretty good, I hope, the opening of the ear above the shoulder. But if I were to take my shoulders and bring them forward just an inch or so, like that, you as a layperson probably wouldn't think anything about that. That's just fine, right, or normal. But when I bring my shoulders forward, I want you to watch this from the camera. If my shoulders are forward even an inch, it becomes very difficult to extend my head. And it doesn't even matter what the shape of my neck is at this point on the x-ray. I literally cannot go any further than that. All right, so now if I were to bring those shoulders back, and these foam roller exercises we're about to go over is designed to help you bring the shoulders back. So if I come back to more of a neutral position, watch the same, kind of get that freeze frame of what the other one looked like compared to this. Okay? And hopefully you can see that difference. So the shoulders coming forward becomes a problem to correcting your spinal issue. Okay? Let me have you come over here, Mike, and I've got an x-ray here. I don't know if you want to zoom or just walk in. This is what an ideal curve would look like. So you can see with this x-ray, a person is facing this way. You can see the jaw and the teeth, of course. You can see that the shape of the spine should have this nice forward arc to it. And that's actually measured at 40 degrees. And 40 degrees is considered to be, the gold standard of what the curve should look like. The other number pertains to the top, and that you don't have to worry about. That's just the angle of the atlas, and 24.9 is also a very good number. So this is an ideal thing that we'd like to see if we were taking x-rays of your spine, and that's what that forward curve looks like. A lot of people have gone straight up and down, okay? And that's what these exercises are designed to do. All right, this is Dr. Lambert at Medical Fitness Wellness Group at Inside Out Chiropractic in Johns Creek. This is an instructional video for my patients and for Mike's clients to demonstrate the proper use of the cervical foam roller, the foam roller for cervical exercises. The idea with these exercises is to get the person from this posture, and I'm exaggerating of course, back into more of a neutral posture. Whether it be because of spinal alignment, muscle tone, muscle tightness, these exercises do both to help with the posture and correction of the spine. So Jay's going to be as our intern. He's going to do a demonstration for us today. So we've got a 36-inch foam roller. It's very important that you buy one if you don't have one for yourself already. That's 3 foot long. As you'll see, traditionally a foam roller would be turned horizontally and you'd work it like this on top of it. But in this case, we wanted to make sure that it's riding the length of your spine. So he's going to sit down at one end. Go slow. Okay. Once you're going, hang on, let me adjust this for you. Okay. And you're going to sit at one end almost like you're on a horse, and then just lie back. And it needs to be long enough so that once you slide down just a little bit toward your feet, so the back of your head is also making contact. Now what I recommend, Jay's done this a couple times with me, and he's a young athletic guy. If you're doing this for the first time, and if you're in a little bit of pain and you're just a beginner with this, you definitely want to start on the floor. The reason we have the aerobic step underneath him is I want to be able to show you what a full range of motion with these different exercises do. And if you're on the floor, that's great to start out, but you're not going to get the maximum effect, okay? And he's only done this, I said a few times, a couple times. And so I want you to see, again, somebody who's even in good shape and is relatively young. This is a difficult thing just to lie on top. And sometimes I recommend, if you can't get on with all the exercises, just to lie on top of the roll like this is going to be a big deal. And here's how it works. It's a 3-step process. Number 1, when you lie on top of this roll, the muscles of your back are forced to work as a team. It's kind of like the first time you ever got on a bike, right? You had to establish balance first. So here, by lying on top of the foam roller and having it centered on the spine, the muscles on both sides are forced to work as a team to maintain your balance. A lot of people, particularly those who have problems with curvatures in their spine or scoliosis, have one side that's weaker than the other, or one side that's tighter than the other. And this exercise can help with that too, just trying to get them to balance out. So that's the first thing, is balance or symmetry of the muscles on both sides of the spine. The other thing that's going to happen is when you lie on top of this roll, the first thing you're going to notice, other than trying to balance on, is that, wait a minute, your shoulders are going to kind of, with gravity, kind of fall back around it. So the second point of these exercises is to stretch out the muscles of the anterior chest and upper arm. If you're someone who's worked out a lot, we all know that everybody likes to work on chest and arms, and a lot of people who are working out and in great shape will have a tendency to be too strong or too toned in front and not quite matching in the back. So this is going to help to stretch out, again, those pecs and bicep muscles, deltoids along the front. Okay, so spinal muscle symmetry, a stretch of the anterior, and then the arm exercises I'm about to show you are going to strengthen the muscles in between your shoulder blades, the rhomboids in particular. So if I'm lying on this roll and my muscles are balanced, okay, and I'm also working to stretch the front of my spine and then strengthening, creating more tone in the mid-back, you're just going to naturally see with these exercises that posture come back to here. And like I said earlier, that's going to allow the correction and extension of the head. So again, I have my patients do this. It helps a lot with the adjustments. It helps you hold your adjustments, keeping it in place for a longer time. We get to the point where you don't have to come and see me, twice a week or once a week. You can do some of this stuff at home on your own. Okay, so to start out the exercises, again, you're just going to lie on top of the roll. If you're starting on the floor, that's fine. Bring your feet up just a little bit, Jay. You're going to start with your feet flat, and then bring your arms up over your chest. See, he's using it to balance. See, and you can see, again, this is not easy. If this was all you could get to start out, this is great because you're getting the balance of the muscles and you're getting that stretch along the front. And that's probably 3/4 of what the exercises are designed to do. So once you get in a balanced position, I would suggest the first time you get on the roll, maybe spend a minute or even 2 minutes just lying on top of the roll to get your balance, get your bearings. Then once you feel like you're there, you're going to bring your feet back a little bit towards you. Not quite that much, about half that. And then you're going to plant your heels. So you're going to go from having your feet flat on the floor or flat on the bench to extend like Jay has here. So, and once again, that's going to create less stability. So once you do that, you're going to find yourself being a little bit off balance again. Take another minute to come to this relaxed position. Okay? All right, so from there, we're going to move into the arm exercises. I have 5 of them. I also have this in a printed form, so if you want to get that from me or from Mike, that's why we have that available. There are 2 things that are very important with the arm exercises that you have to do, otherwise it's not going to work right for you. The first is when you start out in whatever position is the beginning position, you want to make sure that your elbows are locked. So the first one, let's go ahead and do that, Jay. You're going to bring your hands up together. You're going to find a spot on the ceiling right above your nose or mouth that you're going to be pointing to. So a little bit in this towards the head. And that's the starting position. Your elbows are locked straight. You're going to take your hands and you're going to separate them. Go ahead and bring them down towards the floor. Now he's on the aerobic step, so he can go even further than the floor, right? And then the second thing you want to do is make sure that you're pressing at the bottom. So stiff and straight elbows in this case. And when you get to the bottom of the exercise, you're going to spend a little half count there pressing. When you get to the bottom of the range of motion, you're going to press back into the foam roller. Okay? So those are the two things. Straight arms, or more importantly, locked arms, and then pressing back. If you do this exercise, and you try, you can even stand right now and do it from a standing position, you'll see that if your arms are locked and you come back, you can feel the muscles between your shoulder blades. If you get even a little bit lazy, a little bit of a bend in there, not nearly much is happening, so the arms need to be locked. Okay? I call this first one the swan dive because it kind of reminds me of a cliff diver coming, you've all seen this, and falling forward, and that's just an easy way to remember it. So the swan dive is the first one. You're going to do about 10 to 12 reps. You can do these as you get better as fast as you want, so it doesn't have to be push. It can be more of a up, down, push, up, down, push. And you do about 10 or 12 of those. Okay? So after the swan dive, you're going to take your hands and you're going to go from this position and you're going to go ahead and put thumb to thumb like this. So you're making the University of Miami U there, rather, right? So, and the important part here is you're creating enough space in between your arms, because on this one I'm going to have him come back over his head, and you want to be able to clear, obviously get past your head with that. So elbows locked and straight. Let's get back to the starting position. Elbows locked and straight, thumbs together, just coming back. And as far as you can extend, keeping your elbows straight. And at the end, again, you're going to push, right? Push and hold back. And then back up. You're going to come all the way back down to the thighs here, so a full range of motion with the shoulders. At the top, pause, push, and that's 2. And come back here, counts 2. All right, and again, you do 10 to 12 of each rep. I refer to that one as the prayer because it kind of reminds me of this. So swan dive, prayer, and from there you're going to move. The arms are the same for the next one, elbows locked, but now you're just going to split your hands. So instead of coming back together, it's going to be what I call this one the backstroke, right? Because it kind of looks like that. You're going to come back with one and down with the other. Elbows locked and straight. Now it's very easy to start doing something like this. But you want to keep the elbows locked and straight, pressing at the top, just like you would if you're swimming, right? You're going to dig in there with the top shoulder, top hand. And one of the things I like to do to remind myself to keep my arms straight is I like to make sure that my thumbs are kind of brushing by each other, maybe make a little bit of contact to maintain that good back and forth, okay? So that's the backstroke, that's number 3. From there, you're going to move, you're going to form a W with your arms. So your elbow is down a little bit. An important thing here is that the forearm is parallel with the step or the floor. Elbows are bent and locked, just like with the others. You want the elbows locked as you do it. And this one's real simple. It's actually the hardest one to do, most difficult, but it's the simplest to remember. Elbows locked, you're just going to bring your elbows down into your sides. And you're not going to have a big range of motion here. It's going to be 6, 8, 10 inches, but the idea is to press there at the bottom each time, and don't let the arms do this, because just like with the others, you're not getting the same result if you keep in that locked position. Okay, almost looks like a military jumping jack as well, but you want to keep the elbows locked. Okay, I refer to that one. I'm from Michigan. We all made snow angels as a kid. Kind of looks like that to me, so I call this one the floor angel. You're lying back on the floor, making an angel. Okay, and the last one, the 5th one, so I call the punch thrust. So you're going to come back to your original position. This time your palms are all still facing each other, but instead of, like the first one, you're here, you're going to make a fist, and I like to have the thumbs out as well. Elbows locked, and I call it the punch thrust for obvious reasons. You're going to extend towards the ceiling as far as you can, and then keeping your elbows locked, come back and press your shoulder blades back into the roll. Again, not a huge range of motion there, but it's not this. It's not a rowing motion. It's forward and let's see that. Okay, so those are the 5. Swan dive, prayer, backstroke, splitting the hands, floor angel, and then back to punch thrust. And you're going to do each of these 10 to 12 times. If you want to do a second set, obviously just go from the punch thrust back to the swan dive and go. Okay? So those are the things. The whole routine, once you get used to it, balance and doing the arm exercise, should take you about 5 or 6 minutes. There are 3 things you can add to this that'll make it more challenging. Once you get a couple weeks or a few weeks in, I expect you to do this, like I said, 5 or 6 minutes, at least 3 times a week to start. Okay? And the things you can do to make it more difficult, I'm not going to make him physically do these because, again, he's just starting as well. But bring a stool, a bench, pull up to the sofa, and I'm not going to have him do it again, but bring your feet up and take your heels and anchor on the seat cushion instead of on the floor. And you'll see when you bring your legs up, that's going to add a whole nother level of instability. So one is just to have the feet up. The second one is to move down to the end of the roll, and you're now doing the exercises with your head extended. As such, right? And just go through the same routine with the head extended each time. A third option is to take a couple small weights. So instead of open-handed, grab a couple 2-pound, 5-pound, probably 5-pound is good, 5-pound dumbbells, and go ahead and run through the same exercises, using the weights instead. You can see how that would work. Okay? So if you have questions about this, we're always here. Again, I'm the chiropractor, Dr. Dan Lambert. Mike Hardy's the owner and operator of Medical Fitness and Wellness. We're all both very well versed on these exercises, and it can make a huge impact. With or without pain, it can make a huge impact on your posture that's going to allow your spine and nervous system to be healthier longer. All right? Thank you so much.